All right, let's talk about the latest on COVID-19 and the Omicron variant from Health Watch USA. Dr. Kevin Cavanaugh. Dr. K, good morning, sir.
How are you today?
Doing fairly well, much better than Friday. We're over the grandkid crud, so that's good.
The grandkid crud.
Yeah.
That's scientific name for a cold.
It is. It's whenever you get together over Christmas with your grandkids and everybody gets sick. It's not COVID. It's just the standard routine. So we're doing better this morning.
Yeah, I've been meaning to ask a doctor this, because if you start to feel sniffles or you start to feel a sore throat or a cough or something like that, some people may automatically run to go get COVID tested. When should I get COVID tested? I mean, should I wait till I have extreme fatigue? Would there be some signs that would tell me, well, maybe this isn't a cold and I should probably get tested?
Well, with the rapid tests, they are most accurate when symptoms occur initially. And that's one of the reasons why they're running out of tests, because really, ideally, you should get tested as soon as symptoms start. Remember, you're infectious even before symptoms. So the peak viral spreading is right around the time your symptoms start. So yes, if your symptoms start and you think you may have a cough, fever, you should probably go get tested. And that's one of the reasons why the home tests are so great. And several weeks ago, we advised people to go out and buy a bunch of them. We did. And so at least we have a small supply of that to get us through the holidays.
What's this beef? The FDA, there's some people that are complaining that, look, overseas, they've got rapid at-home tests available anywhere and everywhere, and they're in shorter supply here. The FDA is holding up approval on some of these quick at-home tests, aren't they?
Well, I think that they probably are, especially because of the Omicron variant, to make sure that they will still work, because this virus is different. But a lot of the at-home tests, such as the Biax Now, which I believe is from Abbott, works on a protein that is a nuclear capsid protein and isn't much different in this variant. And so they feel that that one is going to work quite well. So the at-home tests are currently being looked at. They do feel that they're still accurate. And certainly the Abbott one looks like it's going to work quite well. So the FDA is going to be a little bit cautious on that with the new variant.
Scott Gottlieb, the former FDA commissioner, was on Face the Nation, I believe, yesterday. And I think he made some comments that he thinks that the Omicron wave, maybe this is just wishful thinking, I don't know, will be very fast in over in 4 to 6 weeks. We seem to keep having this 2-month up-down cycle, go way up, and every 2 months there kind of seems like there's a new variant or something new to be on the lookout for. Dr. K, what's your take on this Omicron variant? The more it spreads, can it create more severity in the cases, even among those that have already been vaccinated? Do you think this is a quick in and out with not making a whole lot of people, at least the vaccinated, seriously sick? Francis Collins, the outgoing head of the National Health Institute, is expecting 1 million cases a day to pop in the United States. What's your overall take on this Omicron from what you're seeing?
Well, this gets complicated with numbers early in the morning. So let's tackle infectivity first. It is highly infectious. Now, the more infectious it is, the more rapid it'll spread through the community, and one would hope that the wave would go up very fast and down very fast. That's just the hope. We were hoping that with Delta, didn't work out like that, but nevertheless, with this variant, it may occur. If you look in the UK right now, they have 100,000 cases a day. That is huge. They're about 1/5 the population that we are. So we could easily reach 1 million cases a day. Now, when you talk about severity, there's severity to the individual versus impact on the community, and both are important. So severity to the individual, it looks like it is no worse than what Delta is, and the high likelihood the infection will be less. If you're unvaccinated, what I've heard, there's 30% less of a chance of going into the hospital and an 80% less of a chance of going into the ICU. That was numbers from Scott Gottlieb. And these, of course, just initial numbers. Now, Two caveats on that. One is if the virus is 10 times more infectious, in other words, you peak with 10 times the cases, you're going to fill the ICU just because you've got so many more people infected. And if the ICU fills, they run out of beds, they're not giving as good treatment, those numbers aren't going to look as rosy. You're going to have a higher fatality rate. People are going to get sicker. The other caveat is South Africa. And this is the important point, and this is the hard point with statistics here, is that country is younger, they're less obese, in fact, they're mostly thin, and they've been vaccinated all within the last 6 months. So those people that are vaccinated, in other words, that you have these really good results of a 70% protection if you're vaccinated against hospitalizations, those people by far have been vaccinated within the last 6 months. Most, if you look at the graph, within the last 3 to 4 months, as our most frail population has been vaccinated early this year, sometimes in January.
Yeah.
And unless they get a booster, they may be no better off than the unvaccinated. And unfortunately, 60% of those that are eligible for a booster have not obtained one. Natural immunity will also give you some protection. We don't know how much with this variant, but what is known, if you get a vaccination, even a single dose, after a previous COVID infection, you will boost your immunity unbelievably, along with the breadth of immunity, the number of different types of antibodies, and get into a state that people call super immune, which is where you want to be with these variants. Also, it decreases your chances of getting long COVID. There's a number of studies which show that. So if you are vaccinated, and this is regardless of the mandate issue, deal with the mandate issue at the polls, deal with the virus by getting a booster. A booster if you've had a previous vaccination, and consider a vaccination the booster if you've had a previous infection. So hopefully I explained that well. This is early in the morning, lots of numbers and statistics.
You did great. And what's kind of scary here is only 19% of eligible Kentuckians have gotten a booster. So we're way behind on the boosters. And I stepped out last week and predicted that those, you talk about mandates, at least those companies that have mandated the vaccine, I think after the holidays, will start mandating the booster shot as falling under the definition of fully vaccinated. Is that where you're going, Dr. Kavanaugh? Fully vaccinated means 3 shots?
The majority of the vaccines, the childhood vaccines, the H influenza, the polio, the hepatitis B vaccine, tetanus, they're all 3-dose vaccines. So it's not uncommon. And the 3rd dose, when you get that, all of the side effects are reported to be less common than the 2nd dose, except one, and that's lymphadenopathy. That occurs in 5% of people. And to me, that means you're getting a better immune response, more durable immunity. And so I think that 3rd vaccination dose is key. It's going to increase the breadth. In other words, the number of different types of antibodies that you have. And I would certainly recommend people getting it. Now, I should note that as far as monoclonal antibodies go, it looks like the Omicron variant is evading all but one. And that's the one made by Vir Biotechnical or GlaxoSmithKline. And from my calculation, they only have about 250,000 doses. And at 1 million cases a day in the US, that's not going to go very far. So your best protection against this, until they get the monoclonal antibodies revved up, until they get the Pfizer viral pill revved up, is to get vaccinated and get your booster. It is preventable, at least severe disease is preventable, but it may not be treatable if the hospitals are filled and these other modalities are not available yet. So please go out and get vaccinated, get your booster.
Yeah, the numbers speak for themselves in terms of those who have had the vaccine, who have had the full quota of vaccine, and their small likelihood that a breakthrough case is going to turn into something severe. Dr. Kevin Cavanaugh with Health Watch USA. Dr. Cavanaugh, thank you very much for your time, sir, and have a good day.
Dr. Kevin Cavanaugh.